the point is, when you calculate, and the reason that, I mean, they intuitively figure out how much to round their back, but when you calculate the lever arm that 600 pounds acts at the, over the lumbar spine, you cannot lift that up. The muscle cross-sectional area of the erector spinae group suggests that you cannot lift that off the ground because the cross-sectional area isn't enough to take 500 pounds times 4 or 5 feet, and that torque, the muscle's not strong enough. So what do they have to do? They have to hang on their ligaments a little bit, let the glutes and the hamstrings pull the pelvis around. Once they get that weight closer to their center of gravity, then the back extensors pull it up. That's how that works. Well, the question is, we as PTs don't teach the rounded back for the individual. You know, Jim had mentioned that work we did with UPS for like 10 years. And I will just say, I feel very confident saying this, that if we had taught those guys, you know, and women, who were doing all this, it was all manual materials handling, it was loading trucks and things like that. If you had taught them to lift with a lordotic spine, I'm sure we would have had more back injuries. The reason is because, you know, oftentimes when we're lifting something, the weight's out here. You can't get close to it. And so if someone is keeping their back arched and they're trying to lift something and it's out here, the lever arm that box has to the lumbar spine is like 3 feet. There's more torque on the spine than if they just got over it and bent down. Not excessive rounding out of the back, but it's a combination of back and hip, and then lifted. So that's why I mentioned before, the key to lifting is how close to the center of gravity of your body can you keep the object's center of gravity. That's what I think the key to lifting is. When you, like anybody who's grabbed a wheelbarrow, okay, I challenge you to get into a lumbar lordosis and push that wheelbarrow. I mean, you round out your back because what you're trying to do is stabilize your back through your ligamentous complex so that you can move your hips. I mean, you can't do it. I mean, just give it a try. Load up a wheelbarrow today, you know, and you go home and do that. So please don't take away from this. He's saying round out your back for all your lifts, because that's not what I'm saying at all. I'm just saying that the way that the central nervous system works is that there's a contribution from the muscular system to support the spine with lifting and movement. And there's a contribution from the connective tissue elements as well. And that's really the message that I want to leave. And for a lot of patients, why do patients lift with just rounded backs and picking up things and things like that? Because they don't have the contribution of their hips and trunk muscles. They're very weak. So they've learned, they strategize with more of these passive support mechanisms than what you and I can do, because we're probably better physical fitness to strategize with our neuromuscular system.